An overview of the physiological development of children in middle childhood will be discussed in this presentation. Children between the ages of 6 and 12 years old are in middle childhood. During this stage, individuals experience physical changes in their height, weight, and brain development. According to Martorell, Papalia, and Feldman, children in middle childhood grow 2 to 3 inches every year, and their weight is doubled during this period. Martorell et al. Stated that girls are more likely to have more fatty tissue than boys, which is completely normal due to the fact that girls physically develop quicker than boys. Growth hormone deficiency can occur during middle childhood. Reasons for growth hormone deficiency include a lack of glandular development and glandular trauma or impediment. Results of a study completed by Pollock et al. In 2017 revealed that an early intervention treatment for the participants with GHD helped them achieve a normal height range. Martorell et al. Stated that adults' teeth arrive during this period. The initial set of teeth, or baby teeth, start falling out at the age of 6. Dental care for children in middle childhood is crucial as it can affect their adults' teeth. Martorell et al. Also stated that fluoride can prevent cavities. Fluoride is a mineral used to prevent cavities. It is used to improve dental health that can be found in most toothpastes, mouthwash, and supplements. According to Martorell et al., oral disease that's not properly treated can lead to severe complications in eating, speaking, and even sleeping. So during middle childhood, children start to advance cognitively due to the fact that their brain is developing. Of course, every child has his or her own time period. Not every child will develop the exact same way. According to Martorell et al., the brains of children in middle childhood goes through a maturational change in which loss in density of gray matter occurs, and there is a steady increase of white matter. White matter is a brain tissue in the brain that's associated with cognition and tasks such as standing firm and walking straight. Martorell et al. Stated that it's extremely important that physiological changes in a child's cortex takes place during this age period. Changes such as thickening in the frontal and temporal lobes and thinning in the brain's left hemisphere of the frontal and parietal cortexes occur. The nutritional needs of children in this stage include proper grains, fruits, vegetables, and high levels of complex carbohydrates. The various benefits of intaking foods with complex carbs are they keep one's body fueled up for a long period of time. These types of food take longer to digest, and foods with complex carbs also help with heart health by reducing cardiovascular and coronary heart disease risk. High levels of complex carbs can be found in foods such as peas, beans, oats, quinoa, carrots, cucumbers, and more. A detailed list of foods can be found on the website listed on this slide. An unhealthy diet can negatively affect a child's physical growth. Examples of unhealthy eating include skipping or rushing breakfast, attaining a third of caloric intake from snacks, attaining too much snacks and drinks from vending machines, and constantly eating out at fast food restaurants. A few of Material et al.'s recommendations for nutritional needs that I personally agree with are: there should be a mandated nutritional courses for schools to follow that can also educate parents. Also, regulating the types of food commercialized to children and acquiring and requiring restaurants to state the nutritional information of the meals and drinks on their menus. As children grow older, their need for sleep seems to decrease. Martorell et al. Stated that sleep challenges such as insomnia, feeling sleepy during the day, and refusing to go to bed is popular with children in middle childhood. There are two main reasons why children tend to have problems going to sleep. The first reason is most children set their own bedtimes. The second reason is they have TVs or other electronic devices such as a tablet or even a phone in their rooms. In order to maintain a decent bedtime routine, parents need to set strict boundaries such as choosing a definite bedtime and also removing electronic devices from their children's rooms at least 1 hour prior to their bedtime. Material et al. Stated that medical conditions are characterized into acute medical conditions and chronic medical conditions. Acute medical conditions are illnesses that occasionally occur on a short term basis. Chronic medical conditions are long lasting conditions that can affect a child's physical development, behavioral development, and or emotional health. According to Material et al., examples of chronic medical conditions include asthma, diabetes, hypertension, and stuttering. Thank you so much for your time today. Here are the references for the information used in this presentation.